Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hana
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin.
Hi, welcome to a next episode. We're continuing about our experience with Dr. Choukroun, about PRF, about blood concentrate, about what we would do to have the best blood to heal, not only in a treatment time, but always. So, yes.
Excited to seeing you too. And yes, I am excited also to kind of go deeper into platelet-rich fibrin, plasma, and how important it is not only within our dental work and surgeries, tooth extractions, cavitations, ceramic implant placement, but also in any surgery or operation or what can be another thing.
Any trauma, any accident, anything you need to deal with in your life, what life brought you in order for you to heal. So anything
also,
you need to get ready.
Yeah, but also, like you said, or just as for our daily life where we're not injured, because that's the aim. We don't want to have a pain. We don't want to have injuries. And to prevent the injuries is to have a beautiful blood which will support my natural healing, because we 24/7 our body's intelligence is working very hard to repair everything all the time. So it is, and I am actually I'm looking after my body, and I love my body enough to actually be cautious about what I'm giving myself, not only in terms of food, but what am I thinking about, who am I dealing with, what my reactions are, because everything is at the end is influencing what the blood is like. So any stress, be it a wound, be it an accident, be it a surgery, but be it a stress and a toxic relationship, for instance. So very important.
Yeah, I agree. I mean, Dr. Choukroun, he said, when do you need vitamin D? Well, he said only when you need to heal, when you have trauma. But then the table and the data he brought on the next slide was that if you take vitamin D3K2, you would have, the data says that it decreases the incidence of stroke, of diabetes, of chronic diseases, of various things. So for me, I think, there is no way back. It's just, this is it. I think it's a new normal to start supplementing and living this way.
Yeah, so why would you just take it when you're getting ready for a knee operation, right? That's what you mean, Eva, right? Because he was actually saying, well, your body can manage. But my point is, he doesn't know what individual need is for certain people. Like for me, because I might be, working physically, but also doing a lot of exercise. Other person might be going through difficult time in life, be it divorce, be it some tragedy. So we all have a different needs. So I agree with you, Eva. Like when he came up with the next slide with how the D prevents those chronic illnesses or metabolic diseases, then what wouldn't you supplement all the time? Or at least when all the time, basically.
Yeah.
But more when there's less sun, obviously.
Yeah, and I would underline it with our data from our clinic, because each client, a part of, I would believe, past few months, a part of 2 clients who are on this healing journey for many years, all of the clients, they were low on vitamin D3. So, and I'm starting on this line because how do I know that everything is fine. So what data do I need before I consider the tooth replacement, which is ceramic, or before I undergo my treatment? In our clinic, it's ceramic implant or cavitations, but in other clinics would be knee operation and hip operation or anything which is needed. So how do we prepare clients, or what do we tell them, Hana? What data do they need to bring with them? Or what do we measure?
Yeah, what we used to measure, Eva, because like from Monday, because we are just taking these precious information from Dr. Choukroun, who's a general medical doctor. I'm just gonna, talk a little bit broadly before I jump into what you asked me. And he is not a dentist. He was having a presentation for all of us implantologists in Switzerland. And it is important for us to hear his message because he is coming from a general medicine world. He sees that through a different lens, and it was just so beneficial. So he was actually suggesting we start taking more data, and he recently came up with like an index which is very beneficial. It's actually something which is lately kind of discovered, or like doctors all over the world just started to do this ratio of blood count indexes and make an index, and based on the index it will tell you how your body's actually prepared for anything, like there it can tell you, okay, well, your risk of Parkinson's is such and such, your risk of healing quick is such and such. So that's why I just went broadly, because what we did so far, we asked people to bring us lipid profile, sugar, so glycemia, glycemic profile, and vitamin D level. But now we're just going to be asking about more about the like white blood cell count, because that's where you then count the index from, and that's very beneficial. So far we did lipids, because the lipids are very, very important, especially the LDL. There's like like probably most people know that there's like this like nice one, HDL lipid, and then LDL, which is the one which is kind of a bad one. And so we were always very cautious about the LDL and its measurements, because obviously if it was too high, then the healing was kind of more likely not happening, or very slow. People would be having issues and pains, and the healing would be very
compromised. Yeah.
compromised.
But this is just a number. So it's essential to say that we like to know this number at the beginning. So that's the very first day. If it's not the first day, it's the second day, because the first day we would talk about it. Second visit, you would bring these numbers, and it's this is a starting line. I like to say, we have some starting line, we go from there. And if the ratios are not ideal, which for vitamin D, we really didn't have many clients who have achieved 50 to 70 nanograms per liter for D3 vitamin in their blood. We would advise them to take supplements, and we would advise them about their lifestyle, about what to do, how to achieve, how to increase this number. But with the LDL, this is the same thing. So we would like to bring into the body, if the ratio is not good, if it's not better than 1.2, then we would advise clients. And I think the best is to start, to say 30-minute walk daily. 30-minute walking, I think the distance who everybody can achieve, and it will be 30 minutes. And what was fascinating, that Dr. Choukroun, he has a data that it needs to be certain speed. So the data says the speed should be 5 kilometers per hour. The clients would say, how? So he would reply, take your phone. We all have smartphones, so we can measure the pace. So 30 minutes a day.
Eva, so for people, so you don't have to really like think about it, it's a fast walk. So you don't go slowly, but you go fast walking. That's probably like 5 kilometers per hour. It's a brisk walk. So you don't go like a lazy walk, kind of,
looking everywhere. You just walk.
You walk, and it is a fast walking. And like
And
Dr. Choukroun was also like sharing his
yeah,
data as well from his smartphone. So you can see that I'm not sure how old is he, but he looks very well. And he does like a lot of walking, was like 2 hours plus for a walk, and was over the 5 kilometers an hour. And he said, I need to get myself be fit because, he's lecturing all over the world. Yesterday, he was in, or the day before we've had course, he was in Brazil. Then the next day, he was in Switzerland with us. Then, he was like in a week in Prague and then somewhere else. So he's traveling all over the world. And so he was sharing, how do you lower the LDL cholesterol? So one of it was
basically it's
physical.
antioxidants. They're coming from food, so that's nutrition.
Yeah.
But I love that he really was stressing the movement, exercise, which is the walk, and then intermittent fasting. So, lots of people, they would say that recovery happens when you eat, just kind of gain. But the truth is that the body is repairing, restoring when we're not fueling the body. So he has, again, great data about intermittent fasting, which starts at 8 o'clock in the evening. And the next food you would eat is at midday. So you would skip the breakfast. So it's 16 hours and great data how you would be in repairing, restoring mode. So
He also said, Eva, in terms of the nutrition, like lower red meat, right? So if someone's dealing with like a high LDL cholesterol, for some time, just lower the red meat, start to exercise, bring much more vegetable, everything green, what is possible.
the greenest color is the best because it has got the most antioxidants, so kale, these kind of superfoods, everything green.
I would go like anti-inflammatory food, so gluten-free, sugar-free, no processed food. He was mentioning that as well, Dr. Choukroun, right? Eva, that was good. Obviously, no alcohol, no smoking, ideally no coffee. And I mean, like, it might seem for some people, oh my gosh, am I going to be living? You are going to be living. Like, I would just like shift the mindset, because if you see that your LDL is really not in a good ratio, that means like high risk of cardiovascular disease, high risk of, like the stroke, the
Metabolic
dementia,
diseases, yeah.
neurological diseases, and every diseases basically. So
All the chronic diseases, actually, yeah.
I mean, like people, when they see it, I would love enough myself to actually do something. So what they need, just to finish the index, Eva, so might be interested what we want to just see. So basically, we would want to see your blood count. So it'll be red cells, it'll be leukocytes, but all the, the measurements. So neutrophils, lymphocytes,
Monocytes.
platelets, which are that very good for us, a source of the growth factors. That's why he invented the PRF. That's why he's using it for surgeries, and we're using it for surgery in our dental world. But then it's HDL, of course, cholesterol in general, triglycerides as well. And then glucose, like I said before, and vitamin D. And then he named it, I don't know if he named it or someone else, but it's called Siri, right? It's not like that.
Yeah.
Siri help, but it is actually the
index
spelling, but SIRI. And there's another index called SII. And it will basically, spit out literally like the index for any disease. So Dr. Choukroun was sharing his presentation. So be it like a risk for like cardiovascular disease, or be it for risk for dementia, but every sense you will be able to predict based on this how you do. So like going backwards, because we all want to live like as long as possible in the best shape possible, because obviously with all our, like in a time when we are living, when we can do anything what we like, meaning traveling, meaning, enjoying ourselves. I don't know, some people like to, I don't know, like skittering like me, or diving, or whatever they enjoy. But we're like, especially in the Western world, we're very lucky, and I'm just so grateful that we can do anything, which means that if you maintain a superb health, you can do it even when you're 70, 80, 90. I was just seeing about this lady this morning. on Instagram. I was just 78 years old lady on surfing on the
Yes,
longboard, and I was like,
that's me.
this is beautiful. That's even like,
Me in 30 years.
yeah, yeah. So
Yeah.
it's very
Yeah, I
important.
like the inspiration. And for us, Dr. Choukroun, he was great inspiration, how body heals. And he was giving us lots of slides of surgery. So it was not only very kind of full of knowledge, but it was also demonstration how body is smart, how it's healing only with the very autologous material, which is our own blood. And also he was stressing how much it's disturbing for the body if there is some material which is not autologous, which means it's not coming from our body. So I have to say, all surgeons, and we usually are surrounded with lots of men, this time also with lots of women, which was amazing to see. But lots of them, there are 20 years of experienced surgeons. They have a career of placing titanium implants, and then they switch for ceramic implants for the benefits of general health. And they were all in awe and really grateful for this lecture to see how is blood and this PRF, which we are all using, all the dentists, biological dentists who were sitting there, we are using it, but how much we can achieve, how much bone growth we can achieve, how much tissue growth, and lots of tricks we have learned on that
But how much
on that
we can achieve
level.
without the synthetic stuff, right? So I think that's
Exactly,
what it
exactly.
needs to be articulated, because he was almost like cross the bovine like materials. We were never been using it, but some people use the bovine grafts, some people use allogenic grafts, synthetic grafts. But why would you actually use the synthetics if the PRF, which is platelet-rich fibrin, which is like we draw your blood and then centrifuge divides the good stuff for you, and then we give it to you back, be it in an injectable like phase, or as in like more
Liquid, yeah.
liquid,
Yeah.
or more kind of a solid. And what was also like very good for me, like we see that it's working because we're using it, but what he said, that it's not even accelerating all of the tissue healing, but also it lowers pain. And when you hear the word pain, everyone's like, oh, pain, because like obviously what we are worried about when we've got surgery, it doesn't necessarily need to be a dental surgery. We all worried about pain, right? No one wants pain. So it does actually lower pain. It is not infectable. That was just
Yeah,
like,
that's a fabulous thing too. You know, people are worried about infection. We have to cover everything. We have to cover this wound. No, it's not infectable. So it's just beautiful. You have open wound healing. Beautiful. All the growth factors are working and they're differentiating for the cells you needed. The body exactly knows what to do. And that's what I really loved. We had full day of slides, lectures, photographs, videos. Yeah, it was fabulous.
yeah, maybe a last note or sentence, Eva. Just like you said, that the PRF, the plasma is just so clever. He was using a lot of word matrix. It's like a matrix for whatever you need. If you need more bone, there's more bone. If you need more tissue, gum, it's more of the gum. So the body is just so
Yeah.
smart. So you can
Yeah.
give him a little bit of building blocks, and the body on itself with his intelligence builds up on it and creates it. So it's been
Yeah.
amazing.
It
And
was amazing. And on the last edition was that the beauty stuff, because everyone wants to be beautiful. So you use the liquid form of plasma for the cosmetics, for your face, for your wrinkles, for your
almost kind of
lines
a
of
natural Botox,
wisdom.
right, Eva?
Yeah,
Like he was showing.
exactly. Plus also for the hair growth.
Yes.
So, you know,
Or scar
I
tissue. Scar tissue.
I have to just really be smiling, and I'm so happy that, because it's just the deep intuition in me knows that the body is so intelligent, that the body knows, our body, we know that how to heal and what is necessary. So I love hearing that with the data, with the slides, with the illustration, with the videos. And thank you for Dr. Choukroun, and I'm sure we would follow him forever.
Yes, and just to recap and remind ourselves and others as well, So the take-home message for me: keep working out, keep doing exercise, because that's, keep moving basically, because that's the key.
Keep breathing, oxygen.
Keep breathing exercises, but movement, like how he was saying, the fast walking. And the second one is just like make sure that your blood is full of rich antioxidants, meaning, eat well, think without like toxic grunges, and, be mindful of your stress levels, because that's all fueling your blood. And based on the blood, then you can repair the rest of your body. So it helps someone, and we can't wait to, share something more what we've learned
And
later
the
on.
next one would be, I think, in few months' time, because Dr. Choukroun, he is developing a new system where he would like to add more saline, meaning salt, which is what we see in our clinic, transformational. If you rinse with salt water, everything heals very well because you go onto alkaline background. It doesn't attract bacteria. Better say that the bacteria which they should stay, they stay, and the one which likes acidic, they go. So he is onto something new, which is exciting. So he's adding more salt. He would call it ocean PRF.
And we were
And we can't
actually
wait. So
really,
once it's there, we will record some update.
yes, I was very delighted, Eva, because we're big on like salt water mouth rinses. And he is not a dentist. And he was just saying, if there's any issue or a cavity, let people to rinse with the salty water for like 20, 30 times a day. And that's what exactly we do recommend to our clients, to you guys. If you are a client, to rinse with salt water, because chlorhexidine, Listerine, all of this alcohol-based artificial stuff is actually harming the oral microbiome. So I was very happy to hear that he's up to something new, and he's just like maybe removing antibiotics from his protocols altogether and might be using salt instead. So let's see. Okay, well, nice to be sharing this, and let's see what we come up with next time.
Yes.
Take care.
Take care.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being. To stay connected, visit us on our website or follow us on social media. If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit. Until next time, remember, healing starts with a smile. Take care, and we will see you in the next episode.